You just left the hospital, you're finally home, and that feels good. But here's what most people don't realize. Leaving the hospital does not mean your recovery is finished. In fact, the first 72 hours after discharge are when many patients end up right back in the emergency room. Not because they did something wrong, not because they were careless, but because no one clearly explained what to do next. And there are a few simple things you should do immediately to lower your risk. Some of them are not so obvious, and that's what we're going to talk about today. Hi, I'm Fairchild. I'm a registered nurse. On this channel, I explain health topics in a clear, simple way so you can feel more confident about your care. Side note, this video is for educational purposes only. If you're worried about symptoms, please contact your healthcare provider. The goal of this video is to give you practical steps to follow after coming home from hospital so you can avoid common mistakes that send people right back to the emergency room. All right, let's begin. Step number 1, review your discharge paperwork. Before doing anything else, take a moment and look at your discharge instructions. Many people put the paperwork aside and never read it, but this document includes medication changes, activity limits, follow-up appointments, warning signs to watch for. Until you follow up with your doctors, this is your roadmap. If something isn't clear, don't guess. Write it down, highlight it, call and ask. Questions are normal, guessing is risky. Step number 2. Check your medications right away. Medication mix-ups are one of the most common reasons people go back to the hospital. When you get home, sit down with your medication list. Take your time. Look for new medicines, medicines that were stopped, changes in dose, changes in how often you take them. Now compare that with what you were taking before with your new discharge list. Do they match? If something looks different or confusing, do not guess. Call your pharmacy or your healthcare provider and ask. It is common for medicines to be adjusted while you are in the hospital. Some changes may be short-term, some may be long-term. Your provider will review your medicines again at your follow-up visit. Bring your discharge paperwork to your appointment. It helps your provider make sure your medicine plan is safe and correct. If any changes are needed, your healthcare provider will talk to you about it. Step number 3, schedule your follow-up right away. Do not wait. Follow-up visits are important. They are part of your recovery. These visits help your provider check how you are healing, review your medicines as mentioned earlier, adjust your plan if needed, catch problems early. Many hospitals recommend a follow-up visit within 7 days, sometimes sooner. The sooner you call, the easier it is to get an appointment. Do not assume you will remember it later. Schedule it before the week gets busy. Your follow-up visit is not just routine, it is a safety check. Step number 4, watch for warning signs. Your body is still healing. Pay attention to new symptoms or symptoms that are getting worse. Watch for things like worsening pain, fever, new or worsening shortness of breath, swelling, confusion, trouble eating or drinking. If something feels different or worse, do not ignore it. Trust your instincts. Call your healthcare provider and ask what to do next. If symptoms feel severe, sudden, or unsafe, seek emergency care. Early action can prevent bigger problems. Step number 5, rest but keep moving safely. Rest is important, your body needs it to heal, but staying in bed all day can slow recovery. Unless your provider told you to stay in bed, gentle movement can help improve circulation, support lung function, maintain strength. Even short walks around your home can make a difference. Follow the activity level listed in your discharge instructions. If you are unsure about what is safe, call your healthcare provider and ask. Balance is key. Rest, move safely, heal steadily. Step number 6, ask for help. You do not need to do everything alone. Ask family or friends to help with meals, medication reminders, transportation. Recovery is easier with support. Leaving the hospital and going home is a transition, not the finish line. Recovery takes intention. Taking these small steps in the first few days can make a difference in preventing complications. If this video helped you, please like and subscribe so we can keep having conversations just like this. And share it with someone who may need this information. All right, that's it. Just ask a nurse.